How's it going, guys? Medium difficulty question for pulmonary step 1 pediatrics TCK. Neonatal male born at term 39 weeks gestation is in respiratory distress. There are no bowel sounds heard in the abdomen. An NG tube is initially inserted and is visualized in left hemithorax. Repeat chest x-ray is performed, which the following most likely be seen in this patient. Now, even if you don't know this x-ray here, there's enough information to easily answer this question. Some of you watching this think this question's too easy. Well, let's just whip through the answers. Choice A, atresia of the choanae, wrong fucking answer. It's part of charge syndrome. The choanae are the nasal passages, so this would mean that they are not patent. It presents with a child who is blue while breastfeeding and then detaches from the breast and appears pink again when crying. So charge, it's a 2CK diagnosis, non-existent for step 1. It's coloboma of the eye, which means basically a hole in the iris. I talk about this in my neuroanatomy as well as my opthal PDFs. Heart defects, atresia of the choanae, retardation, growth and development, genital urinary anomalies, ear anomalies. Wrong fucking answer. Choice B, fistula for tracheoesophageal fistula, because that would be a pertinent diagnosis in a neonate. Wrong fucking answer. So similar to atresia of the choanae, we'd insert an NG tube, and we would not be able to do so successfully because it's going to come into contact / hit the atresic proximal pouch of the esophagus, where you have the distal esophagus that forms a fistula or passage with the trachea. So that'll be the mode of diagnosis following the child coughing up initial feeds. Wrong fucking answer. Choice C, fluid within fissure lines. Wrong fucking answer. Refers to transient tachypnea of the newborn. It's a 2CK diagnosis. I've made clips talking about this. It's going to be a kid where it sounds like NRDS. You're reading the vignette, they say you have a kid who's got difficulty breathing and he's born at term, okay? And so that's sort of what we have here, but our descriptions go against TTN, transient tachypnea of the newborn, okay? But it's going to be a kid who's born at term via C-section, and normally passage through the vaginal canal that pressure forces the amniotic fluid out of the lungs. So it'll be a kid born via C-section where there's just simply too much amniotic fluid left in the lungs, / there's decreased clearance of the amniotic fluid out of the lungs by pulmonary lymphatics. And they can tell you within the vignette that chest x-ray shows fluid within fissure lines. Wrong fucking answer. Choice D, hernia, correct answer. So this is going to be congenital diaphragmatic hernia, and I gave you enough descriptors in the vignette here. Some of you would think that this is pass level, but they can just say there's no bowel sounds heard in the abdomen because the bowel has moved through the left hemithorax or into the left hemithorax via the hernia in the left hemidiaphragm. Okay, it's always on the left. And they can likewise tell you that there are dilated loops of bowel or just loops of bowel seen in the left hemithorax, which is what we visualize here. Almost looks like bubbles. If we were to try to conjecture what we're looking at, it's bowel in the left hemithorax. Okay, so they can say there's bowel sounds in the left hemithorax. They can say various permutations of that type of point here. So the NG tube, they can also say it's in the left hemithorax because when it's inserted and it goes down into the stomach, well, you have herniation of the stomach up in the left hemithorax. Holy shit. So I'd written the question and then I put the x-ray here and I was like, well, how convenient that my x-ray doesn't show the NG tube in the left hemithorax. So I just, rather than finding a new x-ray, I just said a repeat x-ray is performed and I showed you the other buzzy x-ray, which is the bowel in the left hemithorax. So the highest yield point for USMLE is that the mechanism for this is failure of formation of pleuroperitoneal membranes. Okay, failure of formation of pleuroperitoneal membranes is very buzzy, and I've made other clips on this as well, where they can give you the same fucking question, and then that's just your answer. So let's just whip to the final one, hyaline membrane, wrong fucking answer. This is obviously neonatal respiratory distress syndrome, NRDS. These are going to be membranes of protein and dead cells seen within the alveoli, secondary to deficiency of surfactant, which is classically going to be in children born under the age of 34 weeks, where they do not have a sufficient lipid ratio, the lectin to sphingomyelin ratio, aka dipalmitoyl phosphatidylcholine to sphingomyelin ratio, which would be greater than 2 to 2.4. So that would be NRDS. Wrong fucking answer. You know the deal. To make more content, if you like my stuff, subscribe my channel. Appreciate your time. That's it.